Well, our next area of discussion is planning and preparation. The purpose of planning is to influence future events. Unfortunately, inadequate planning at the local, state, and federal level greatly contributed to Katrina's horrific consequences. No one person or government agency could prepare for the catastrophic blow that Hurricane Katrina dealt the Mississippi Gulf Coast.
Unfortunately, there's going to be times that we as responding agencies at the state and local, federal level, we just can't get to everyone as quickly as we'd like. So that's probably the biggest lesson learned.
Since Katrina, the Mississippi Emergency Management Agency has built a new multi-million-dollar state-of-the-art facility and quadrupled its staff through federal and state funding.
So we have more operations people, we have more training, exercise, planning people. We have a larger staff that can prepare for and respond to any type of an emergency.
The relocation of equipment, supplies, and emergency shelters is also an important step in the right direction for the Mississippi Gulf Coast.
So in the infrastructure, we lost a lot of city equipment, a lot of county equipment. From that, we know that we have to move it north also and keep it out of harm's way. We have two brand new high schools which were came about because of Katrina. We've built some FEMA 361 shelters, which are the high wind impact, 200 mile an hour standards. These shelters can house 3,000 people at each shelter. They will come self-equipped with water, their own water systems, their own sewer systems, their own power plant. So we're going to have a community inside of a community at these shelters.
Improving evacuation routes like Highway 67 from I-10 to Highway 49 demonstrates the continued preparedness that is taking place all along the Gulf Coast.
Never again will we be caught with our pants down. We've put our plan in place with minor storms like Gustav, and we have an agreement with the community college 45 miles north of us. We move equipment and personnel up there. We keep a skeletal crew here. We have taken a Katrina worst case scenario and stepped that up.
Even though people had discussed it, it was all talk.
Katrina overwhelmed planning efforts in almost every category. The evacuation of New Orleans represented both the best and the worst in planning for megastorms. Terry Ebert headed emergency preparedness for New Orleans during Katrina.
Nowhere in America had you ever moved 90% of an urban population in 48 hours.
An effective contraflow plan vastly increased outbound New Orleans area traffic by rerouting highway lanes. But the state agency assigned to evacuate citizens with no transportation had neither the operational plan nor the resources necessary to carry out the task. Over 100,000 people were left stranded. At the local level, New Orleans never arranged to use hundreds of available school buses or contract with Amtrak to carry thousands away from danger. The state now has contracts for bus, rail, and air transport for those in need, according to Louisiana Department of Social Services head Christy Nichols.
The bottom line is we have 50,000 evacuees that don't have transportation that we have to plan for, and we have sufficient capacity to shelter them if we had a storm tomorrow.
Many of those evacuees, however, would have to go out of state. A large state-owned shelter in Alexandria and newly passed laws that encourage storm-proofing public buildings will add in-state capacity. Nonprofit agencies assisted many Katrina victims. A lack of coordination impaired their effectiveness, according to Melissa Flournoy, director of the Gulf States Policy Institute.
I think that nonprofits were called on to jump into service without the authority or the direction of how they integrated with the state and federal plans.
Pat Santos, the state's Assistant Deputy Director of Emergency Preparedness, acknowledges improvement is needed, but overall he's pleased with the state's planning effort.
I think the awareness is much greater. The attitude of leaning forward and being ready and having those resources ready to go is light years ahead of where we were for Katrina.
And General Honore, when you arrived down there, everybody was like, well, the military's finally here. I mean, were you astounded at Katrina that everything was in chaos when you got there?
it wasn't that people were incapable. The storm overmatched everything, and it was a worst case scenario that finally came to play its card in New Orleans that we have talked about for years, and this time it happened. And many of the people that didn't evacuate, there was a sense that, well, you know, we've had storms before, we'll ride it out. And then you have people who wanted to leave who couldn't leave. I do think we have to do a better job in the state with shelter. There's something known as a 200-mile-an-hour building. We need to build them, and we need to build more of them. There's some folks in the other states that are getting a little tired. You know, they take our
They're
folks,
weary.
Right. Arkansas, Mississippi, Alabama, we've leaned on them hard. We need to build our capacity here in Louisiana to take care of our own people. Amen. And we need to do it. We need to do it quick. FEMA need to give us the money to do it. So, because when we shelter people inside the state of Louisiana, we can get them back home quicker. And last year we were bringing people back home and we were having a football game. We got to reset our culture here to take care of our people.
Can you give us some concrete examples of ways that we're working with our food banks, our nonprofits, to pre-position supplies, to get ready in advance of a situation like this, so that as soon as the winds die down, nonprofits that can react very quickly are ready to go and can go to work?
We had heard about the problems that happened during Katrina, where you'd have trucks loaded with ice on the interstate and they couldn't find anyone to talk to see where they could deliver it, whether it was a food bank or a shelter. So that's a much more coordinated effort at this point. Last year we partnered with NIMSAT at University of Louisiana Lafayette, and we've to establish what we're terming a Business Emergency Operations Center, which supports businesses and nonprofits, so that if there's a need that's out there, we can match that with either a volunteer organization that may be able to fit that need or a business. And that's something we're going to be doing to a much larger extent for this hurricane season and even bigger in the future. And again, this is one of the best practices that we hope that the rest of the country might be able to emulate.
Gerri, do you feel like planning is in place?
Well, I think that the planning is starting to get in place. We are working very closely with organizations like the Louisiana Association of Nonprofit Organizations to be sure that nonprofit organizations have plans in place for themselves so that they can respond, but also to have them look at their role in response and participate appropriately in that. But again, the nonprofits need to come be more included in the planning earlier.
During Katrina, when evacuees found themselves in their respective areas for extended periods of time and away from home, and school shut down, they did not know where to enroll their kids during their time away before their own schools could be started up again. Is it possible that Louisiana schools can partner with schools in other states so that families have a destination in mind when they evacuate?
The governments of St. Bernard, Orleans, Jefferson, and Plaquemines, all in advance of a storm each year. They come in the spring to sign an agreement with us about housing their vital operations to make sure they can still communicate with their citizens even in the event of a storm. And so I would suggest, and it's not you, but I think that's the model we need to adopt, is have the school systems begin to communicate with each other in advance, put agreements in place, and then know the hours that both can operate and move those schools forward in that direction.
Excellent question, and one maybe we can follow up on, because certainly that's one thing public broadcasting is talking about doing, is doing electronic schools and having classes at shelters. And also helping people do that, because that's where you can use new technology and communication to do classes like that. So, and you have a follow-up over here.
Hi, I'm Kathy McGoey. I live in Baton Rouge now, but I was in New Orleans during Katrina and evacuated ahead of the storm, thank goodness. There was a lot of discussion about a mandatory evacuation, actually making people leave. And I know it was a little controversial about, well, you can't really make people leave. I mean, how do you all feel about that?
I know of no law, unless they've changed that in recent years, since Katrina, that you can actually force people out. The big thing is to get to the vulnerable population, the elderly, the poor, and the disabled. And we still got to break the code on the disabled, on where they live and who's going to go get them. We could do better that in America. We are a better country than that. but we need to have disclosure of where they are and use the faith-based communities and the nonprofits to know that's got to be a community. That has to be a street organized event. Otherwise, there's going to be some people who don't know that there's a storm coming because they're isolated and they live alone or the elderly.
One time for one more question from our group. Yes, come on.
Yes, hello. My question for you pertains to the homeless veterans and also the psychiatric clients that are homeless and are on the street. You know, when this is going on and they say you need to move, they do not have money. Some of them cannot make the appropriate decision to leave. What do you have in place to take care of these people?
They can be picked up off the street, but 72 hours, I think they have a decision to make. If in 72 hours there's not a commitment, the hospitals have to release those individuals. They can't hold them there. And there's not a massive facility to take care of homeless vets or the homeless population in general. What we are finding is, I think just like she said, you're finding people with mental illnesses that we're going to have to address that problem.
Well, let's hear what the folks in Mississippi have to tell us about the status of planning in their state.
Thank you, Beth. We actually have a lot of the same questions that you have in Louisiana. And so I think to start us off, Cindy Griffin has some questions about we'll let Cindy ask the question.
I'm Cindy Griffin. I'm the Executive Director for Habitat for Humanity here in Jackson, Mississippi. And we played a lead role in helping to establish the rebuilding program on the Mississippi Gulf Coast. And a lot of communities, a lot of faith-based communities in Jackson as well as around the country participate in the rebuilding and the disaster recovery. So my question to the panel is, have plans been made to include faith-based organizations and non-governmental organizations to coordinate with them, access them, to help utilize their resources in another disaster?
Well, thank you for what you do. And thank you to Habitat, because we wouldn't be where we are on the Mississippi Gulf Coast. I think Tim would agree about this, without the faith-based organizations and organizations like Habitat. You just jumped in and helped us when we couldn't help ourselves. Working with the state can be a difficult thing. We have not done anything legislatively that I think will expedite things. We need to do that, and we need to do it statutorily.
And I guess to speak on the volunteers, just in my county, we've established an emergency support function for volunteers in case we have another, and I know we will, another disaster. So we're going to have at least some kind of coordinating with the state and the local level and the real needs out there. And I think any of us, and I know we talked earlier, we had a lot of volunteers, we didn't have a lot of direction for them, but we have established at least now and have in place procedures and guidelines to handle the volunteers coming, and I think be able to coordinate and manage that much better than we did before. The more you can be organized as a volunteer organization, and then the more you can join with others that have similar goals, then the more effective you can be. So I'd like to see the non-faith-based that don't want to affiliate with Red Cross or Salvation Army, try to find others that do the similar missions that you can work together with. And then certainly we want you to work with the Mississippi VOADs, we want you to work with the Mississippi Commission for Volunteer Services.
We work with private nonprofits and individuals that volunteer at a national level, regional level, and a local level. I think one of the things that we've done is work to harness that capacity, not only through providing grants, training programs, but integrate them into planning activities when we start to develop specific plans on how we'll respond to a future event. In addition to that, each FEMA region has personnel that are dedicated to work with these voluntary agency coalitions to build capacity and to work and develop these plans. In addition to that, we've brought Red Cross representatives into our regional offices to help build this and reach out to different groups. So we'll continue to do that, and it's a much needed area to improve future disaster response.
And Senator, you had
I would just like to recommend that the areas of expertise are a good place for the nonprofit organizations to come together. For example, all the groups that provide and help us with mental health, if they would work together, it would be much easier to get a hold of them and also to, you know, get money to them. And I think this is an opportune time to mention that I don't think it has to be limited to Mississippi. I think Mississippi and Louisiana can work together on these things and should, because sometimes we don't know until it hits if the storm is going to be Mississippi or Louisiana. And at the last minute, one might be in better shape than the other. It might not be a Katrina situation, and we could be ready to jump in and help the others.
When the Superdome, when they released and opened the doors for the evacuees that were there was an influx, a flush of people, of families that came into Jackson. And I and my family, and I'm actually a coach. My name is Jackie, and I'm a headmaster at New Horizon Preparatory School. And when it hit, we went down and we worked and volunteered at the Coliseum. Now, those people that came in still had the same clothing on that they had 2 weeks prior. They did not have change of clothing. It was like a shock, and no one knew what to do or what, you know, how to move. Has anyone even thought of or discussed how that went, and if that situation happens again or arises, are we prepared?
Some of the things that we've worked on, and I think Mark Cooper talked about it a little bit in Louisiana, is improving the evacuation plans. Last year during Gustav and Ike, we supported them with evacuations through providing contracts to support people by rail, by bus, and by air. In addition to that, we brought and integrated volunteer agencies in there. So not only did we move the people, but we provided them assistance once they arrived at the location we were evacuating them to. And a lot of that was coordinated with the states. And some of the other things that we've done is by improving our plans for doing this and by incorporating the private nonprofits into the planning of these evacuations and into this deliberate planning process, so that we identify ahead of time what those requirements may be. And then the last part of this is individuals have a responsibility. If you know that every year that you're susceptible to hurricanes, not only do you need to make sure that you have enough supplies, but you also need to make sure you have an evacuation plan. What is that plan? If you don't have a vehicle, where will you fit into the overall evacuation plan? And what do you need to bring with you, and what will be provided to you? So I think it's being looked at in many different ways, but I think everyone has a responsibility to help with that on the team, whether you're the individual, local government, state government, or the federal government, or private nonprofits.
And Jackie's question really kind of helped us lead into our next area of discussion, which is risk reduction. Beth, back to you in Baton Rouge.